So the main point that I want to bring across in the talk is really the difference between the human and the mouse neuromuscular junction. And one of the key features of this is the developmental expression of the adult and fetal forms of the receptors. And so much of our knowledge on the neuromuscular junction is based on mice and the mouse neuromuscular junction, but the developmental profile of the fetal and adult form is different in mice than to human. And therefore, one has to be very cautious about transferring the information that one knows from mice to the human situation. And in the talk, I illustrate how actually the human differs from the mouse situation, and this has major implications for the actual progress of the disease in humans, as opposed to what's known in the mice. In mice, the fetal expression ends very sharply by 21 days after birth in mice. Whereas in humans, you get low level of the fetal expression of the fetal form throughout life. So there are many, many mutations in the adult form, the epsilon subunit of the human receptor. And if you had these in mice, it would be lethal. But you have them in humans, and the fetal form of the receptor goes on being expressed, albeit at a low level, and therefore patients are affected. But patients survive quite happily and would have a normal lifespan. And even some of them with null mutations in their epsilon subunits are able to run marathons. So there's a huge difference between what's occurring in mice and what occurs in humans. And so in humans, the fetal form goes on being expressed in all muscles all the way throughout life. On the converse of this, you can in fact get null mutations of the fetal form of the receptor. And in mice, again, this is lethal, but in some humans, you can have null mutations of the fetal form of the receptors. And in fact, babies are born and will actually survive on that adult form of the receptors throughout life. So it has a converse. In fact, if you have null mutations in the fetal form of the receptor, it is very severe in humans. But again, you have this plasticity of the expression of the fetal and adult forms that isn't seen in mice.